We have 71 new cases who have tested positive today, bringing our total of test positive cases in British Columbia to 1,795. That includes 745 people in the Vancouver Coastal Health Region, 747 in the Fraser Health Region, 110 people in the Vancouver Island Health Authority, 153 in the Interior Health Region, and 40 in Northern Health Region. We have a number of outbreaks, as you are aware. We have 3 new outbreaks in long-term care facilities that were announced earlier today by Fraser Health, all of them in the Fraser Health area. And as we know, we have been putting a lot of attention at detecting any cases in our long-term care sector very early, and that's a reflection of the numbers that we're dealing with. We have 20 ongoing outbreaks in addition in long-term care assisted living and one which is in an acute care unit. In addition, 4 of the long-term care facility outbreaks that were active in Fraser Health have been declared over. In our other outbreaks, we have 77 cases associated with the Mission Federal Correctional Facility and the ongoing investigation and support to that facility with Fraser Health, including the infection prevention and control and outbreak investigation, continues. There are 5 inmates who are in hospital currently. In addition, we have the 28 cases we talked about yesterday that are reflected, the outbreak that's ongoing and the investigation that's ongoing into the poultry processing plant in Vancouver Coastal. In terms of our case status, 103 people are currently hospitalized, and of those we have 46 people who are currently in critical care or ICU in BC. We have an additional 3 deaths to report today, bringing our total of people who have died from COVID-19 in British Columbia to 90. They are all people in the long-term care homes, and our hearts go out to the families and the caregivers. We now have 1,079 people who are fully recovered from COVID-19. As we talked about yesterday, we continue to experience new community outbreaks in British Columbia, and this, of course, is very, very concerning to me and to all of us. This tells us that we have more work to do to break the chains of transmission in our communities and to make sure that every individual, every business, every community, every family does what we need to do to break these chains, and that's everyone all the time. We can't afford to have any weaknesses in our firewall if we are going to be able to move ahead into our new normal. We know people are tired of staying apart from their loved ones. We know we are tired of not being able to do the social connections and events that we are used to doing. But to ease restrictions, we need to have a decline in both the number of new cases and the numbers of outbreaks. And as I've said many times, there are things that we can control and there's things that we don't have control over. What is happening around us, both in the United States and in other provinces in Canada and internationally, affects us. And we know that that is one of the reasons why we have to be so vigilant here in British Columbia. Until we clear this hurdle, we can't begin to make changes. One of the most important things that we all need to do is to stay home if we're not feeling well, and with no exception right now. We know that many people experience very mild symptoms with this virus, and some may think it's just the sniffles or perhaps even just allergies at this time of year. It makes it really hard to tell if you have COVID-19, but you can still transmit it to others, even with very mild symptoms. So let me be 100% clear. Right now, if you are ill, whether you feel it's a cold, whether you feel it's allergies, whether you are concerned you might have COVID-19, stay home, stay away from others, and immediately contact us, and we can help you get tested if that's appropriate. We also expect that employers need to pay attention to this and need to be responsible. You must have measures in place to ensure everyone who's working is healthy and can keep a safe distance from each other in the workplace. We do not penalize employees for staying home if they are ill during this pandemic. Employers need to understand that an outbreak in your business has effects on all of us. It also can have significant financial impact both for the business and for your employees. As we've seen with a number of businesses recently, an immediate shutdown is required so that we can ensure that we're not passing this on in those situations. Your own business will only be able to open again once we are confident that it can operate without putting people in danger, the employees or the community. So as we are planning for what we want to do in the near future, in our new normal, these sectors and businesses need to think about these. We need to address these issues before we can reopen safely. We need to have measures in place to keep people safe, to avoid further outbreaks. If we start having these types of outbreaks and spread in our community, we can overwhelm our system, and that's what we've been working so hard to avoid for the last few months. So we need to have enhanced cleaning, both personal hand hygiene, as well as in our environment in the workplace, being able to keep a safe physical distance, and supporting employees and others to stay away if they are ill. We need to have a plan for every business that is open in the event that an outbreak should occur, so that we can detect them early. We can remove people from the workplace. We can connect with public health and ensure that we are isolating people appropriately so they aren't going to be transmitting it to others. There's an order providing this guidance for industrial camps, and we've given guidance for those businesses, those essential businesses that have been open. We need everybody to follow these, and we need the same from other businesses as we look to opening things up in the coming weeks. We need to keep our firewall strong, and we have to be 100% committed to all of us doing our bit to see our way through this storm. I want to take a minute before I finish today to just say a word to, we're aware, I think many of us are more aware today about the details of the senseless tragedy that has folded in Nova Scotia, a place that's very dear to me, in this time of unparalleled challenge. And I just want to say to my Nova Scotia family, wherever you are, and to my RCMP family, know that I'm heaving a sigh and a wish for thee, and will mourn with you from afar. So all of us need to do our part, and we need to continue to support each other in doing that. We need to be calm and to be kind to each other and to be safe.
Thank you very much, Dr. Henry. I know that everyone in British Columbia agrees and has the same feeling for the people of Nova Scotia today, and what they're going through, and the grief, the collective grief that people are going through in Nova Scotia. I also wanted to start by acknowledging the families of the 3 people who passed away from COVID-19 in the last 24 hours in BC. 2 were in Fraser Health, 1 in Vancouver Coastal Health. All were in long-term care. But all those families are going through grief right now, and not just the grief of a loved one passing away, but the grief of the circumstances we're in, when people are all often separated from the ones they love in these very important moments in families and in communities. So our condolences and our thoughts go out to all of them. As Dr. Henry has said, today is a day in terms of the numbers, which sometimes people will analyze after these press briefings, that we have 71 more cases today, reflecting the situation in Vancouver at United Poultry in part, and others, and as well the numbers in terms of acute care, where we have 103 cases, which is, I believe, the lowest number we've had in the month of April, down from a high of 149. And in critical care, 46, which is also the lowest amount we've had in April, show the continuing effort made by the community, I think, to break the links of transmission of COVID-19, and something that we have to continue to commit to In acute care hospitals today, there's about a 62.1% occupancy rate, 4,222 vacant beds. As a report, 46% of critical care beds are currently occupied. And there has been some interest in what's happening in emergency rooms, whether people are seeking the care they need. Again, yesterday, more than 4,000 people visited emergency rooms across BC, which is up from just under 3,000 on April 6th, although continuing to be down from the normal, say March 9th, when it was approximately 6,500 visits. So that tells you that people are, from where we were in April 6th, returning and using healthcare services when they need to use them, and I think that's an important thing and something that we will continue to encourage. Often we celebrate people who are working and essential workers. I wanted to acknowledge that April's Constructions and Skills Trades Month, that there's frequently events recognizing people in construction, people, skills trades people across British Columbia, and obviously there isn't the public recognition and the public celebrations that often accompany this, but we know that thousands of construction workers are working on roads and hospitals and other critical infrastructure needed to keep water and electricity flowing, that construction sites and sector and work sites have made significant adjustments to the way they operate, and we wanted to acknowledge them, all their contributions, both to BC society and to our communities in every part of BC. Also wanted to offer for the people who live with dementia, or who are supporting a loved one living with dementia, people know about the First Link Dementia Helpline that is available as a resource. This is run by the Alzheimer's Society of BC. Helpline staff and volunteers can provide support and information, very important in these times, about resources in the community. So, and that number is 1-800-936-6033. And just to let people know that the Alzheimer's Society has extended First Link Dementia Helpline hours that in English. That number again is 1-800-936-6033. It's now Monday to Friday, 9 a.m. to 8 p.m. In Cantonese and Mandarin, it's 1-833-674-5007, and that is Monday to Friday, 9 a.m. to 4 p.m. And in Punjabi, 1-833-674-5003, and that's Monday to Friday from 9 a.m. to 4 p.m. And I wanted to acknowledge the extraordinary ongoing work in this difficult time of the Alzheimer's Society, which I think everyone in British Columbia who's ever been associated with the Alzheimer's Society knows that work and will appreciate that. And in these times, that work is even more important. There are a lot of questions, ongoing questions about surgery and the resumption of surgery. I just want to note that from the period March 16th to April 19th, the total number of postponed surgical cases in BC was 13,988. The total completed cases, because we of course have continued with urgent scheduled and unscheduled surgeries, is 11,936. So even though there was that we have deferred and canceled what are sometimes called non-urgent scheduled surgeries, but essentially just scheduled surgeries that are all important, as we know, there continues to be a lot of activity in terms of surgeries in BC and extraordinary work continuing to be done. We've never had this period in surgeries, it should be said, this need to renew on the scope and to go back potentially to having surgeries again in BC, to resuming elective surgeries, which we hope to do, of course, at some point. And I just want you to know, as we proceed with this work, our commitment to patients has not wavered, that you are not forgotten, that you are at the center of what we're doing, that we have been planning a resumption of surgery, which we are continuing to work on ever since the elective surgeries were canceled. That work continues, and I want everybody to know who's waiting for surgery that they are in our hearts and in our thoughts, and most importantly, in the work that's being done across health authorities in BC. And finally, I think we see the case, whether it's Cargill in Alberta, whether it's United Poultry here in Vancouver, whether it's the circumstances at the Mission Federal Institution in Mission, the significant and ongoing risks posed by COVID-19 to the health of people in British Columbia. And what it says to us, surely, is that we have to continue to do what we need to do, to be 100% all in. This is particularly important in light of these outbreaks, on the question of working sick. And just so everyone understands, there will be, and we are working hard on ideas of how we can move British Columbia forward from this point. But what is not going to change, what cannot change, and which has to happen now, is people have to stay home when they're sick. And this is going to be part of the new reality during this period of pandemic. Sometimes I think there's a sense that it's the brave thing to do or the courageous thing to do to play hurt or to work sick. Well, that can no longer be the case, and that is the responsibility of both employers and employees. That's something we have to continue to work on, but we have to especially have that happen now. Since we've been giving these briefings in January, that has been a consistent theme. Washing hands, not touching your face, but most importantly, staying home when you're sick. It's the key part. It may be the most important part of being 100% all in. And we really need, in light of today's numbers and in light of these community outbreaks, we really need people to be 100% all in right now. And just finally, the Premier announced today the opening on April 27th of the Urgent and Primary Care Centre in James Bay in Victoria. And it shows what we're continuing to do. We need to continue to expand our public health services across BC. If anything about the last few months has told us anything, it's how important public health care is to everyone, and we're going to continue to make these efforts. And as you saw earlier this week in Castlegar, in Vernon, and Abbotsford, those efforts have expanded through urgent and primary care centres. And today I was delighted to hear the Premier's announcement of the opening in Victoria.